Whelan Presley Funeral Home and Crematory have been serving Quad City families and veterans since 1889. Whelan Presley Funeral Homes are located in Rock Island, Milan, and Reynolds, and are proud supporters of WQPT. Alternatives is a proud supporter of WQPT and has been serving our community for 40 years. Alternatives provides professional guidance to maintain independence and quality of life for older adults and adults with disabilities.
The flu, COVID, and RSV, what health leaders are doing to better protect us. And the Putnam Museum wants your children to use their minds and their fingers right now in the cities. It is the season for runny noses, fevers, and headaches, but this year, a particularly nasty respiratory illness is hitting our kids hard, just as the nation finds weakening COVID variants spreading all around. And the regular flu season is upon us right now. A healthy dose of precaution is needed by all of us, young and old, but what does that mean? We talked with Community Health Care Executive Director Tom Bauman and CHC pediatrician Dr. Swetha Kandula about what we can expect right now and through the holidays. Let's start with the RSV. Is it waning at all? Because we know that it peaked early and it really hit kids hard.
Yes, so we did see a spike late summer, late July to mid-August, and then we did not see much at all throughout the September and the first half of October. But since late fall, late October to early November, we saw a huge rise in the cases, significant increase in the hospital admissions, even kids requiring higher supportive care from the, even needing ICU admissions. And I would say over the past week, it has started to slow down, but I wouldn't say it has waned yet.
Well, and that's interesting that you would think that it's starting to slow down because people were worried because of the holidays, that families are gathering more, that it may spread quicker and more widespread.
And it typically does. All these viral infections, they are easily transmissible, especially in indoor crowded spaces. So when people get together a lot during the holidays, we typically see an increase because otherwise all these kids going to schools and daycares, they would be just in their families versus when it's holiday time, they get together and there's just more likely spread of infection. So holidays is always a time where we see an uptick in the cases.
Is there anything that people should be doing? Because you can't stop the holidays.
No, definitely. I mean, there are some simple measures that we can do our best to protect our kids. So especially if families have young infants, especially less than 6 months to a year-old babies, then definitely be very, very vigilant about frequent hand washing, avoiding crowded spaces, and avoiding going to people's houses when they have newborns or young infants if they are sick with any respiratory symptoms.
Or older people as well.
Older
because
people as well, definitely.
These viruses are really so tough on the people that are in the greatest health issues.
RSV hits hard the younger infants and the older population.
CHC has been busy, since COVID, making sure that more people do get treatments. You're the safety net for the community. What have you seen since the pandemic, at least, has waned?
Yeah, well, I mean, the pandemic has waned, but you have seen a lot of people that maybe delayed care or did not seek out care during the pandemic, or maybe were only being seen via telehealth or using urgent cares, that type of thing, coming back into regular routine care. So our clinics have been pretty busy across the board at all of our locations, and our docs, our waiting lists, we have some waiting lists here and there. So it's been a challenge, kind of going from the emergency phase of during the pandemic to trying to get back to what is our new normal and what works for our patients as far as access goes. So it's been a challenge, but patients are coming back to the offices.
It has to be somewhat worrisome because people put off medical procedures or medical attention, and as we all know, that worsens the situation. So the overall health of the people that you're seeing, does it seem to be that more has to be done quicker for more people now?
Well, Dr. Kandula is a physician.
Well, sure, absolutely.
So we have definitely stressed the importance of regular health maintenance visits for all our younger kids. And we have stressed to parents that they have to be done on time because we don't want them to get behind on their routine immunizations. And then we want to avoid an increase in those infections, of course. So we have always tried our best reaching out. We always remind families when do they have to come back for their next visit. And at the same time, in the clinics, we are making sure that we practice good hygiene measures to prevent spread within our offices. So we have done, and we have definitely seen an increase in the mental health issues as well. And we have offered increased access, and we have always told families to please reach out to us whenever they need us. And my suggestion to the communities is to always reach out to your pediatrician if your child ever has any upper respiratory illness symptoms first before heading over to the emergency departments. And then we don't want to overwhelm the hospital systems as well. So if there are any concerns, please reach out to your pediatrician
First line of defense for you as well.
Definitely.
What have you learned at CHC as far as pivoting, changing? I mean, is there areas that you now have to add more concentration? Because we've been talking about behavioral and mental health. We're talking about dental. We're talking about a bunch of different issues.
Sure, we've done a lot of different things. We've created an express care access in our Moline clinic that helps us in a number of different ways, helps with that acute access for people with respiratory that might be infectious to others. We can kind of have them go to a specialized clinic where they're not going to be sitting in a waiting room with patients who are there for checkups. We've done more outreach where we've gone out to schools, or we've gone out to service provider partners when we're dealing, especially, trying to do COVID work and that sort of thing. So, it's been a transition. We use telehealth a lot. We used a lot of check-ins with our patients during the pandemic, especially our chronic disease patients, to make sure that they were staying up to date on their, if you're a diabetic, making sure you're getting your A1C done, or if you have hypertension, monitoring that. So we've tried to leverage technology as well to be able to keep in touch with our patients. And now's the time where we can start bringing them back into clinic for more routine care and to catch up with their doctor.
Yeah, because to be honest, some people just don't want to see their doctor. And I don't mean this in a bad way, but COVID gave you an excuse not to do it. And so it's tough to get them back in the door?
It's not tough, but it is getting back into the routine. And so for us, we've really focused on access and being very efficient in the clinics and making sure that we're building in time for those patients that maybe have not been to the doc for a while. We've also added additional clinicians to our group to build more capacity here in the Quad Cities and Muscatine and Clinton as well, just to try to add more access for everyone.
Dr. Kandula, the other thing, of course, is COVID. Once again, we're seeing another variant that seems to be spreading quickly. We talk about these variants, and I know people get tired of it and think COVID can't it be over? But this is typical of a virus to split into other mutations. Is it also the fact that it spreads quicker, but it isn't as serious? Is that typical that it's mutating, but its deadly effectiveness is mutating down?
So last year during the winter, we saw the Delta variant, which was more virulent than the original COVID variant when it began. But then since the Omicron started, Omicron variant is different, that it has better capacity to spread and much faster. And it's also been able to evade the protection provided by the vaccine in terms of spreading. But Omicron variant has been less virulent than the Delta variant. So it's easier to spread. It's spreading faster, but it's definitely not causing as severe of an illness compared to the Delta variant.
And that is typical?
That is typical because this virus has learned how to spread faster, so that is the predominant variant all across the world right now, because it's just able to spread faster. So, and it is still mutating itself. It still wants to get better at spreading even faster, and that's what we are seeing with the newer sub-variants in the Omicron as well.
So doesn't it get to be that you just got to live with it, and it's just going to be another type of flu that we have, or just another illness that will be out there? Our body is also changing as well to fight fight it off, but that you'll need the booster, you'll need the shot, you'll need some kind of a vaccination.
Definitely, yes. It is, looking at how the past 2 years have been, it looks like it's staying like how we have the flu and the RSV, and it has its own subvariants, and when they emerge and then we see a spike in the cases. But definitely with the vaccination, and most of the people who have had infection before have some level of immunity so that the disease is not as severe anymore.
The argument of herd immunity, I was going to say mentality, which is another thing altogether. Do you also see that, that there was such a huge backlash towards vaccinations, perhaps because they were mandated in the way Americans act, you can't tell me what to do. Are you seeing some of that backlash about immunizations for children among everything? Is that waning a bit? Is the pendulum swinging back that parents are going, yeah, I got to get my children vaccinated, or are we still seeing a real resistance to that?
So whenever a vaccine is new, there is always a hesitance about whether it is safe or not. We haven't known this vaccine for a long time, so there was a lot of resistance in the beginning. But we are overcoming that, and I think we are headed in the right direction. People are more comfortable coming back to the offices now for their regular well visits, and they're getting all the immunizations on time. And we definitely have seen an improvement in the acceptance rate for even the COVID vaccination among children.
So that's good news as far as that is concerned.
Yeah.
Tom, let's talk a little bit about your staffing. Because we had talked about that during COVID as well as towards the very end of the pandemic. I know it's not over totally. How is staffing right now? How difficult is it to find nurses and practitioners?
You know, we've been incredibly lucky. We have a really engaged workforce at CHC, but we definitely, like everybody else in the economy right now, are having some workforce challenges, especially in areas like medical assistants, dental assistants, hygienists, pharmacy techs. We've done a really good job on retaining and recruiting physicians and nurse practitioners and dentists and our professionals there, but many areas and pockets of the support staff have been particularly difficult, although we fared maybe better in some cases. But there's a number of factors on that. There's people wanting that flexibility in work, so we've tried to introduce things like work from home if the position makes sense to do so, or being flexible with scheduling and looking at ways that we can help basically incentivize people to stay with us, whether it's loan assistance or helping with retraining, those types of things. So we're taking a number of steps, but definitely workforce has been a big challenge and continues to be and will continue to be as there's just a lot of macroeconomic factors
Yeah, absolutely.
at play.
Well, and do you find people, I mean, there's a certain amount of people that probably because of COVID, because of the pandemic, say, we got through this. I saw the amazing work that doctors and nurses and other people in the medical field did. I want to be a part of that. Do you see that, or do we just see a continuation of people not necessarily getting into the health fields?
There aren't enough in certain spots, right? So there aren't enough physicians, for instance, going into primary care at this point. There's not enough hygienists that are entering into hygiene school, and some of that is a lack of available training opportunities or spots in hygiene schools, and then there's other factors, of course. So I think there's a combination. I think you do see some people that are trying to get into healthcare, and we're setting up internships and training programs to help them in that endeavor, but it's kind of both sides of that aisle. Yeah.
And we've talked in the past also one area that ended up being a critical need, and that was behavioral health and mental health. And people really had to get through this pandemic, which affected young and old and everybody in between in so many ways that I think there's going to be case studies on this for a long, long time. What have you done as far as beefing up behavioral health, mental health services through CHC?
Yeah, so we run kind of a primary care version of behavioral health, so we want to make sure that we have a therapist or a psych nurse practitioner that is embedded within our care team so that they're easily accessible to our physicians and nurse practitioners and others who are doing the primary medical part of it, and we can make those warm handoffs and connections. We do a lot of screening for depression to identify folks. We've added additional services for substance use disorder. There's a lot of drug use and alcohol use. That's becoming even more prevalent in our community, so we've added services around those. So our game plan is just to continue to add therapists and counselors so that they can be part of that care team, so that when a patient is identified, when they come into our clinics, that they have resources and access to care.
And Dr. Kandula, you are a pediatrician. I mean, you can spot it in a child perhaps quicker than, obviously much quicker than I could. What should parents be looking for? I mean, is there still an impact of COVID among our kids today?
I would say yes, and especially during the pandemic when a lot of kids were doing remote learning from home and they were not getting to be around their friends, and the routines were a lot different than what they were used to. A lot of sports wasn't being held during that pandemic, so it definitely has affected. We have seen increase in the rates of depression and a significant increase in eating disorders as well. That we had noticed. So we have improved screening at every visit that they come to the clinic for. We have also tried to educate parents on what to look for, like behavioral changes, whether they appear more sad than they're normal, whether they are preferring to be more isolated, not wanting to get out, and all those things. And there was some fear also among children during the pandemic about the COVID itself, because they hear about it from everybody, and they don't know for their age how harmful can it be. So education has gone a long way in addressing that, and definitely I would recommend parents to watch for any unusual changes in their behaviors or eating patterns, or them not enjoying their hobbies like they were used to. Then definitely reach out to your pediatrician. Early screening, detection, and therapy goes a long way rather than waiting too long.
Absolutely, and you're going to get the last word, and I want you to have your pitch. You really want people to get vaccinated. You really want booster shots. It's the best defense.
Yes, I highly encourage to get all the routine immunizations, and it's very, very important to get them on time, because there is a reason for the schedule being that way. You are susceptible to different infections at different age groups, so it's very important to get all your vaccines on time. And not just that, but in the winter, we are definitely going to see an increase in all sorts of respiratory illnesses. Since not just the RSV, but we have seen a tremendous increase in the influenza A infections as well. So we should do everything that we can to protect our kids from whatever we can. So I would highly encourage people to get the influenza vaccine as well, because even influenza, just like RSV, hits the younger population and the older population very hard. We definitely can avoid hospitalizations. Vaccinated kids tend to do way better than unvaccinated when they are hit with the flu.
Community Healthcare Chief Executive Officer Tom Bowman and pediatrician Dr. Swetha Kandula. Well, it's just days from Christmas, and you may want to get out of the house and do something other than shopping. Laura Adams joins us out and about.
This is Out and About for December 16th through 22nd. St. James Lutheran Church is holding their annual live nativity event on Sunday, December 18th from 4 to 7, while the John Deere Planetarium at Augustana College present their annual holiday program Season of Light through the 16th. It's time for the Putnam Museum's annual Polar Express Pajama Party through the 18th, and the Quad City Botanical Center's annual Winter Nights, Winter Lights Outdoor Light Extravaganza continues through January 1st. The Mockingbird on Maine's new adaptation of A Christmas Carol runs through the 17th. Magician David Cassis performs at the Central Theater in A Magical Christmas in Geneseo on the 17th. A very brassy Christmas presented by the Big River Brass Band takes place the 18th at 3 at St. Paul Lutheran Church on Brady in Davenport. The Bucktown Review celebrate the holidays with a show on the 16th at Davenport Junior Theater at 7. Comedy Sports Quad Cities performs at the Spotlight Fridays and Saturdays at 7, while Weisenheimer Long-Form Improvisation celebrate their 11th anniversary at the Black Box Theater the 16th at 7:30. Also, at the Black Box, All Is Calm, an a cappella retelling of the historic Christmas truce of 1914, is presented through the 17th. Circa 21 presents Irving Berlin's White Christmas through the 30th. Plus, auditions for Barefoot in the Park at Playcrafters Barn Theater take place the 17th and 18th at the Moline Theater. For more information, visit WQPT.org.
Thank you, Laura. The Bucktown Review is enjoying the Christmas holiday with friends and family. We hope you are as well. But last year, they sent us all a very nice Christmas card. Here's the Bucktown Review.
everybody out in Bucktown land. Cora and I just want to wish you all a Merry Christmas. Hope you enjoyed the time with your family. Keep in mind the reason for the season. We'll see y'all real soon. 1, 2, 3, 1, 2.
What child is this who led to rest on Mary's lap and sleeping? Whom angels greet with anthems sweet, while shepherds watch are keeping. This is Christ, the King, whom shepherds go and angels sing. Haste to bring him, Lord, the beggar son of Mary.
Merry Christmas.
The Bucktown Review's Christmas card. The Putnam Museum is bringing back a little bit of summer during these cold winter days. It hosted a successful hands-on exhibit during the summer months that is designed to get all of us thinking a little bit more about science, technology, engineering, and mathematics, better known as STEM. Build, Create, Innovate Winter Edition is back in action at the Putnam, and the new director of Museum Experience, Kelly Lau, joins us now to talk about it. Well, the Putnam actually had this STEM program back in the summer. Was it just extraordinarily successful that you had to bring it back for the winter?
Oh yes, this has been just wildly popular. Kids love to get hands-on,
Yeah.
as we know, and they just really enjoy it. So we thought we could bring this back with a little bit of a twist on it for the
Do
winter
tell.
season.
How is it different this winter?
So our our staff has created some unique pieces that are a little different than the cityscapes and some of the other buildings that you naturally think of when doing some kind of engineering building project. And they have created snowflakes, reindeer,
Sure.
train. It's really a nice component to our winter offerings, along with the snowflake look, Christmas lights, giving that kind of beautiful look to the gallery.
Well, I mean, here they are. These are the planks, right?
Yes.
That you were talking about. They're kind of smallish, but you can do anything with these.
Oh yes.
And here's the thing: is that I mean, it's so much for look at you. It's
yeah.
so much for STEM education,
Yeah.
which is such a big deal right now. But I also noticed that not only are you doing it for kids, it's kind of a family thing. Adults can get involved in this as well.
Oh yes, we have so many different offerings for families to kind of engage with each other. So when kids are trying something out and maybe they're building something and it falls over right away,
Sure.
you know, the family can step in and be like, oh, have you thought about doing it this way, and unlock new levels and build to new heights with these Kiva blocks.
Yeah.
So
But
it's great to get together with that.
Well, and also, like you said, I mean, you're creating something, but you also, I don't want to say it's a competition, but you do want people to take selfies or take some pictures after they're completed, so you can compare and contrast what various people and families do.
Oh yes, and I think a little bit of competitive nature is always kind of fun. We have lots of different collaborations with the First Lego League and Build Bridge Builders of the Quad Cities, with all the different engineering and firms, and those are all competitive based, and see who can build a bridge out of popsicle sticks that lasts, or robotic Lego pieces that compete with each other. So these
And then you take
are
that
just, yeah.
and add imagination,
Yeah.
and it's pretty amazing. But what I did think that was interesting, that you did point out, are the sponsors of this. A lot of them are the building and trades organizations, the construction companies all throughout the Quad City area.
Oh, yes.
And they want to get people young. They want to train people to get involved in engineering, architecture, all these things. And that's kind of where the Putnam is as well, is that it is a learning as well as a fun and an artistic event.
Oh yeah, it's great to get an interest, spark an interest that could maybe lead to a career in a skilled trade that can really benefit different families from all over the Quad Cities. You know, the access to these hands-on materials and working with your family can open up new possibilities and avenues that maybe you don't learn about right away in school, or you haven't thought about for yourself as a young kid who hasn't come across that. But once you get older and you realize what kind of talent you might have for it, what kind of creativity you have for it, it might open up a door of a possibility that will last for your whole life.
Holiday season is a big time for the Putnam Museum. I know you brought these as well because, let's be honest, the big screen is a holiday favorite, whether you're seeing a Polar Express or a number of other films that are being featured right now.
Oh yes, we have the Super Dogs, which I really love because I have a penchant for German Shepherds.
Okay.
So those dogs that kind of have their own way of helping us humans out. There's the America's Into the Wild National Parks, which is just breathtaking to see, especially during this winter time when
and especially in that theater. I mean, because you really do become immersed in it.
Oh yes. And just seeing the vistas and the scale of the canyons and mountains, it's just really breathtaking.
Plus you got butterflies.
Oh yes.
So I mean, in the deepest of winter, you've got butterflies.
Color and beauty and nature when we don't maybe want to go outside.
Well, and please, I mean, check out the Putnam website. You can find out exactly the times and the dates when it's being aired. And I do also notice, and you also have the Explorers and Junior Explorers programs that are going on right now, which is so beneficial to kids.
Oh yeah, those are really great weekend programs that kids can register for. Our education staff is incredible in putting together something hands-on that kids can work with other very small group and learn an activity, whether it be about water molecules to rocks, and we have just different topics all school year long.
Well, and even perhaps more importantly, of course, all school year long, but also during winter break.
Exactly.
And I know that you do some special programs just to get the kids out of the house, but at least learning something during this break.
Oh yeah, and that's what utilizing that Kiva space, running around our science center, looking at the tornadoes, using the science of music and creating sounds in the gallery. It's a great energy release. There's tug of war and different, kind of physical things where you learn about mechanics, different physics, different things like that. And in our, very large space, you can go through the Hall of Mammals, find your birthstone in the Hall of Minerals, which I was doing this morning, actually.
You found yours, huh?
Yeah, it was very beautiful.
Kelly Lau of the Putnam Museum. The 15,000 Kiva planks are ready for you 7 days a week at the Putnam on Museum Hill in Davenport. But check the website to make sure it's open if you want to build something during the Christmas week. On the air, on the radio, on the web, on your mobile device, and streaming on your computer, thanks for taking some time to join us as we talk about the issues on the cities.
Whelan Presley Funeral Home and Crematory have been serving Quad City families and veterans since 1889. Whelan Presley Funeral Homes are located in Rock Island, Milan, and Reynolds, and are proud supporters of WQPT. Alternatives is a proud supporter of WQPT and has been serving our community for 40 years. Alternatives provides professional guidance to maintain independence and quality of life for older adults and adults with disabilities.